Thank you so much for this opportunity to share my journey and my vision. My name is Rebecca Gilmour and I'm a current intern at the World Federation of Public Health Associations. My academic background includes a master's degree in global health and a bachelor degree in adult nursing, both from King's College in London. Both have provided me with the knowledge and skills to address health challenges in humanitarian settings with a focus on conflict and displacement. My professional journey began within the NHS, where I gained experience providing healthcare in high-pressure clinical environments. During my time at university, I had the opportunity to undertake research projects focused on critical global health challenges, including the impact of war and conflict on health in Syria and the challenges faced by displaced populations in the UK accessing healthcare for non-communicable diseases. These projects deepened my understanding of both the inequalities and resilience associated with conflict and displacement. Travel has been a part of my development. I've had the privilege of exploring Europe, Asia, New Zealand, and Australia, where I've learned about different cultures and approaches to health and well-being. These experiences have reinforced my commitment to improving health outcomes for those living in conflict-affected and vulnerable settings. Through both my academic background and my experience in healthcare, I have developed a comprehensive understanding of the complex relationship between conflict, displacement, and health. My ultimate goal is to advocate for evidence-based solutions and improve both healthcare access and healthcare outcomes for populations affected by war and conflict. My vision for global public health is centered around ensuring that populations affected by war, conflict, and displacement have access to quality and sustainable healthcare. I believe it's important to highlight that global public health in these contexts is not just about immediate relief, but it's about rebuilding health systems that foster long-term recovery and resilience. War and conflict heighten systematic inequalities, leading to the collapse of healthcare infrastructure, economic instability, and exacerbating barriers to healthcare for displaced populations. I believe that addressing these challenges requires interdisciplinary collaboration. Global public health links with other sectors such as housing, governance, education, and human rights. And tackling these complex issues requires professionals from various fields to work together in order to create evidence-based policies and address the specific needs of conflict-affected populations. Advocacy and empowerment is another key part of my vision. I believe that rebuilding resilience in communities is critical, particularly in the face of adversity. By involving those directly affected by conflict and displacement in the solution-making process, we can design health interventions that are not only effective, but also meaningful and sustainable. As I look forward to the future, I see my role in global public health as one of driving innovation, advocating for change, and fostering collaborations. Combining my knowledge and skills in healthcare and global health, my primary focus will be to develop solutions that effectively address the health needs of those affected by war, conflict, and displacement. Research will be a part of my contribution. I'm interested in studying the health impacts of conflict and displacement and how healthcare systems in war-torn regions can be rebuilt. My goal is to generate evidence that can inform policies and practices that improve healthcare delivery to displaced populations in conflict zones and in host countries. In addition, advocacy will be a significant part of my work. I am passionate about using my voice to advocate for those whose health and well-being is impacted by conflict. My aim is to work to ensure that the needs of those affected by war, conflict, and displacement are recognized and addressed on a global scale. Ultimately, by combining research and advocacy, I hope to advocate for health equity and resilience in the most challenging settings. I'm committed to improving healthcare access, rebuilding health systems affected by conflict, and supporting the long-term health and recovery of displaced communities. For my take-home message, I would like to highlight the importance of advocacy. Advocacy is essential in addressing the health challenges faced by displaced populations and those affected by war and conflict, as it ensures that the voices of these communities are heard and policies are put in place in order to protect their health. While global public health professionals play a crucial role, advocacy should not be limited to experts alone. Everyone from policymakers, humanitarian organizations, to local communities and individuals has a role to play in speaking up for those affected, whether it's pushing for better healthcare access, influencing policy decisions, or raising awareness on a global platform. Advocacy bridges the gap between those in need and those with the power to make a difference. Globally, forced displacement is at an all-time high, so we must use our voices to demand for sustainable solutions that prioritize dignity, equity, and health for all.